What are the indications, though, the clear-cut indications for cannabis? According to Health Canada, HIV weight loss, MS spasticity, neuropathic pain, chemo-induced nausea, vomiting, and chronic pain. So if anybody ever calls in and wants to know that, that's what you can tell them, and those are the indications for treatment. For the pharmacist, your college has great resources up, like probably better than some of the medical colleges. So the Canadian Pharmacists Association has some modules that are great as well. Things are changing. Stigma's reducing, cannabis is becoming more mainstream, especially when you think about CBD. So World Health Organization took a stand and said, to date, this is actually just from December, there's no evidence of recreational use of CBD or any public health related problems associated with the use of pure CBD. In fact, evidence suggests that CBD mitigates the effect of THC. So they're on board with this. They see treatment for epilepsy and go on to say possibly in Alzheimer's, cancer, psychosis, Parkinson's, and other serious conditions, there could be some effect. So that's good that a nice big governing body like the World Health Organization is coming around to CBD. More evidence, more time we can study this. Again, Schedule I drugs weren't even allowed to be studied because there was no therapeutic effect. So one of the knocks for physicians, they'll say, but there's no evidence. Well, part of that is because you weren't allowed to study it. So now that we're seeing again some more compelling stuff. So this is another recent study, 2,800 patients, so not a small study. They found, again, it was related to seniors. Patients 65 and older for 6 months found medical cannabis treatment significantly relieves pain and improves quality of life for seniors with minimal side effects. We'll go over the side effects, contraindications in a bit. But again, it's all about, yeah, you want to reduce pain, but you want to improve quality of life, and that's another great thing cannabis can do. Another study just showing cannabis showed reduced intensity of pain, improved sleep. This was from Mark Ware, who's essentially the guru on medical cannabis, and this was one of the first studies to demonstrate in chronic pain. I'll skip by this because this is just a survey, but part of the reason I have it in here is because you'll hear some of these statements quite a bit, good and bad. So we'll talk about the one with fibromyalgia. So that's a condition you'll hear about where you do see people respond quite nicely. So this is a typical statement. I have fibromyalgia. I live my life in constant pain, daily pain, and on average it was an 8. Common. Started taking medical cannabis. I now have a daily pain average of 2 to 3. Again, realistic expectations to tell patients is it's not going to get rid of your pain completely. It's not the miracle drug. It can help though. So the other thing is, and this is the most important part, pain, yes, quality of life. So after 2 weeks of cannabis, I cooked my first meal in 15 years. My husband was doing all the cooking and housework, and now I'm able to help out with it. So reduces pain, improves quality of life. That's a real classic thing that I get to hear every day, which is why I love what I do. But this is another thing I hear every day, and this is the reality of it. Medical cannabis has not made a difference for me. I've never used it before, and I was a little hesitant to try. When I did, I found that I had no relief of pain, and I didn't like the way I felt, so I discontinued use. That's another accurate statement, and I didn't like the way it made me feel, so I stopped. Not too bad. As Raf mentioned, Canadian Pain Society is coming on board here, so they upped it to a third-line agent for neuropathic pain, and there's some hintings and every indication that likely when the next revision comes out, it'll likely be a second-line agent, which I would agree with, and I use it as a second-line agent. Again, because given its favorable side effect profile, if I have to choose between lamotrigine and CBD, let's say, I like things that, you know, part of medicine is do no harm, and again, you have that opportunity with this, given that favorable side effect profile. But this was again the one from Hopkins in states with medical marijuana, 25% lower prescription drug overdoses. Echoing that, JAMA did the same kind of idea just last year, actually it was this year, Prescriptions for opiates decreased by 2.1 million daily doses where medical cannabis is legal. Is it the answer to the opiate crisis? No. Is that a complex issue? Yes. Does it show promise though? Yeah. Should we be exploring it? For sure. So they go on to say medical cannabis policies may be one mechanism that can encourage lower prescription opiate use and serve as a harm abatement tool in the opiate crisis. So it could be a tool in the toolbox.